Joining us in studio, our studio guest, Lauren Bostrom. She's a physician assistant at Tripp Family Medicine here in Twin Falls. They're located on Fillmore Street on the north side of the city, directly across from the main post office. Although I talked to the doctor yesterday at the grocery store, and I was telling him, there's a discussion that the mall might become mixed use with housing. Probably would be a lot of seniors living there. And I said, you should move the offices to the mall, and then you'd have a ready-made clientele. But the office is still looking for new patients. We should point that out. And Tripp Family Medicine can often see you on the very same day if you have a medical issue. You call early in the morning, if not within 24 hours. We say generally because I think some people think that's a guarantee, and they get busy. Lauren is one of only 4 medical providers. I guess you have some
Yeah,
nurses as well, though. So,
we do. And kind of real quickly, I just wanted to reintroduce myself since I'm the newer physician to Tripp Family Medicine.
right.
So I'm a physician assistant like Jeremy and Russell. I'm able to see patients as they are, but we all work very closely as a team together alongside Dr. Tripp. And what I hope you find when you come into this practice that's a little bit unique to other practices I've been at is we're a very cohesive team from the administrative staff, front desk, nursing team are following your health every step of the way together. And one of the things that you'll find when you walk into our office is it's more of a homey environment. We try to limit that white coat syndrome as much as possible, um, which isn't always perfect,
I've been up
but
there for lunch before, and everyone's just kind of casual sitting around in the
yeah,
break room.
yeah. We're very casual. We try to not be too sterile there. We keep it clean, but we want to make sure people feel at home and as comfortable as they can. Because it's not, I would say, probably not most people's favorite thing to do in their day to come to the doctor's office, but we try to make it as enjoyable as possible.
We're talking about over-the-counter medicines today, and I was one of them that was on the list was ibuprofen, and the only time I ever used that, I remember it tasted. I thought it was like chewing on steel, and I guess I was supposed to just wash it down and not chew on it. But when I was working for the postal service many many years ago, I used to sometimes get those. You turn it twist a certain way, and you'd get a little pain in the one side of the lower back. And a friend said try ibuprofen, so I bought a bottle and I used it a couple of times, and then when my muscles tightened up on the job, I got back into a little shape. I didn't have to worry about it. And I moved and I took that bottle of ibuprofen with me, and it sat in a cupboard for about 2 years. And I figured at that point it was no longer any good, and I threw it away. But there's some concerns about a lot of these over the counters. First of all, I mean, lots of people have overdosed on over the counter medicines, but some of them also have some other effects people should be aware of.
Yes, exactly. And I can tell you, I see lots of patients who suffer from complications, and ibuprofen and the other NSAIDs or non-steroid anti-inflammatory drugs, which include things like Aleve, which is also has the ingredient naproxen in it. We see a lot of complications. And I would say the most common and concerning one that I see is people who end up with actually chronic kidney disease from taking it. And these are people who are taking it at the recommended doses on the back of the bottle, but they've been taking it every day for years and years.
Hmm.
And that can lead to some long term damage. And so, one of the things that I encourage people, if you're one of those people who suffers from chronic pain, make sure you have a primary care provider who's helping to check that kidney function and making sure that your kidneys aren't suffering as well on top of the pain that you're going through. And your provider should be able to help you find some alternatives if there are some concerns about your kidneys too.
We wanted to mention as well, you've got a couple others you listed here, Tylenol, some things that side effects that could happen with that as well.
Yeah, so Tylenol, the biggest one on that one is liver can be liver damage. And so if you're someone who has liver trouble, you shouldn't be taking Tylenol probably. And if you take Tylenol, making sure you stay in the recommended doses. And for the general population, that's less than 4 grams a day, although I'd encourage kind of minimal is better. And for older population, especially those who have multiple chronic diseases, they really say 2 grams a day at most with the Tylenol.
Now with aspirin, and a lot of us older fellows, we take that 81 milligram tablet. Mine are yellow, and they're coated. So again, if I bite into them, I don't necessarily get that foul taste. But aspirin itself, if you're using it on a regular basis as a painkiller, also would have some side effects.
Yep, aspirin does as well. It's usually the higher doses that increase your risk of having things like stomach bleeds. They did a study on the 81 milligram dose that's enteric coated. coated, which means it's safer for the stomach. They found that there's not a big increase in stomach bleeds if you stick with that 81 milligram dose, but once you start going higher, you're increasing that risk of bleeding, especially if you're a fall risk. And if you were to fall, you could have a serious bleed that may be hard to stop. Should you suffer a fracture or hit your head. So those are all kind of things to be worried about and important discussions to have with your doctor.
I was going to say the 81 milligram. The reason that people are taking that is because it's going to be a lot less harmful than taking a bigger tablet every day.
Yep, and they have found the 81 milligram dose. And once your heart risk goes up higher, which tends to happen with age, we can't control that one. And if you smoke, high blood pressure, other factors, taking just an 81 milligram dose of aspirin a day lowers that risk of having a heart attack or stroke. And really taking that higher dose, they haven't found a great increased benefit with that one, unless you have other medical conditions. And if your doctor has told you to take a higher dose, you probably should.
We've got more coming up with Lauren Bostrom. She's a physician assistant working at Tripp Family Medicine in Twin Falls. We're at a break right now. We've got 30. It's coming up on 8:40. We'll be here talking with Lauren until 9 o'clock this morning. Also, Tommy Alquist, candidate for governor, will be joining us just after 9 o'clock this morning. He's going to give a reaction to the governor's State of the State address this week. Plenty more ahead, and your telephone calls, too. Our studio guest is physician assistant Lauren Bostrom. She's joining us from Tripp Family Medicine this morning. We're coming up on 8:43. We're at 31. Bill Colley answering the telephones on News Radio 1310 KLIX. Quickly, the telephone number, if you've got a comment or question about some of these over-the-counter medications, telephone number is 208-736-0300, 208-736-0300. And yesterday when I was at Winco and I was walking through the aisles before I ran into the doctor, I was going down one of the medicine aisles, and wow, there's a lot of over-the-counter medicine. We'll just say that. Cold medications are one you wanted to address this morning as well.
It is. It's that time of the year where everyone's getting sick. And I'm going to kind of start off with talking about our pediatric population. It's hard to watch your little one being sick, coughing. But one of the important things I wanted to bring up is if your kid doesn't seem sick enough to go to the doctor, the American Academy of Pediatric has issued kind of a statement saying over the counter medications are not recommended in children less than 6 years old. Overall, they found there's not a huge benefit compared to placebo, and the risk really outweighs the benefit. And so, if you're looking at kind of treating your kid at home, if they don't seem that sick, what they have recommended if you have a kid less than 6, using nasal saline drops, a couple of drops in the nostril, nasal saline suction, and if we're talking about sore throats, using honey with hot water if your kid is older than 1 year old, because I will make kind of a side note on that one. If your kid's less than 1 year old, you do not want to use honey. They can get botulism from that. But if they're older than 1, that's a perfectly really safe natural option to go with. And using humidifiers for those kids with a cough can help as well. And if you're kind of struggling with what to do, then going to the doctor's office to get kind of a medical recommendation of what needs to be done at home.
You know, when you mentioned this with the antihistamines, what caught my attention, you've got a list of side effects here that can happen, and it's lengthy. One of them, it says arrhythmia, and my gosh, um, with a child, you don't want anything like that. Obviously, their that heart has to last them decades.
Yeah, yeah. So with any of these medications, there's always a risk, and so with the Benadryl, I mean, it can make your kid sleepy, which you might find, and some of you might find it does the opposite for your kid because some people do get kind of a paradoxical response to it. Um, but there's the risk of irregular heartbeats with that. Sometimes kids can retain urine if taken too often. And again, they did a lot of studies on this, and they found kids younger than 6 really don't have much benefit with adding this in. So it's hard to resist that temptation to kind of want to try to do something for your kid, but sometimes letting their immune system fight it off is the better thing to do.
I know that you've got cough syrup listed here too as well, and when I was a kid, there was nothing I hated more. My mother would bring this stuff home called Vicks Formula 44. I don't even know if that brand still exists any longer, but it was dreadful. It luckily that they taste bad, so you don't want to drink more of it. Obviously, there's a reason for that. But that itself, certain cough syrups you write, could have some issues with young children too.
Yeah, and one of the concerns I want to bring up, because I have a lot of patients come in and they have some leftover cough syrup with codeine in it that they have at home, and they say, I decided to give it to my kid because they were coughing, and I just had some leftover at home. This year, they came out with a big warning saying pediatrics, that's kids younger than 18. I know they don't look like kids anymore, but really should not be on cough syrup with codeine. Just what it can cause is respiratory depression, which means they're sleeping and have taken this medication. Their brain might lose that signal to breathe, putting them at risk for aspiration. And so it's something I highly recommend against if you do have that at home. Making sure it's something that your doctor has recommended, and not something that you kind of decide to do on your own. And that goes for the general population. That's a risk for everybody.
I jumped ahead of decongestants. That's in the middle of this list with children, and obviously there's some concerns here too about heart issues, blood pressure, and the like.
Yeah, so decongestants, these are things that you'll find in Sudafed, includes ingredients pseudoephedrine and phenylephrine. Those are probably the two most common you'll see. And for kids, and this is even for adults too, if you have a heart problem, you do not want to take this medication. It can cause irregular heartbeat. If you have high blood pressure, it's another medication to avoid because it does increase the blood pressure. And they have said no benefit in kids younger than 12 years old on this one. So trying to, again, kind of, even though you'll find medications that have these in there and it says children's, um, a lot of the research has said maybe to avoid these.
When I think about things that I use when I'm congested, I buy the over-the-counter Vapor Rub, for instance.
Hmm.
Usually by the store brand, it saves me maybe a buck over the Vicks. Um, when I would remember when my daughter was little, we had people telling us try to avoid that because there was some concern that kids could ingest some of it or it would get into their nasal passages. And I found a solution in her case. She hated the stuff anyway, but there was a company in Western New York State that manufactures one that's a fruit flavor, like a cherry type of smell to it. So the kids didn't object to it as much. But there's some concern. I was also told like Vaseline around the mouth and nose if you've got a cold to try to soften your lips or whatever. That also can have some side effects too.
Yeah, Vaseline a little bit less concerning than Vicks, vapor rub, and I'm going to kind of throw it out there because essential oils are becoming really popular.
Hmm.
So eucalyptus oil is another one on the list of things to maybe avoid in your kids because things like Vicks vapor rub, it's tempting for kids to think that this is something they can ingest or eat. And there's a large number of ER visits for kids actually ingesting the stuff and having some toxic effects. And again, we're going back to that CNS depression. Um, and also looking at the fact kind of risk versus benefit. And in kids, it's maybe not worth that risk.
When I think about when I've got a cold, one of the things that I've found that probably has worked best for me over the years is a little cup of NyQuil before I go to bed. It comes in the little cup, and I do it. It has been for me at least. I have gotten good night's sleep out of it, and it seems to help me get through the night without a lot of waking up with a cold and issues like that. But I can recall a sad, sad story about 15 years ago that I had to cover where a young father, not realizing the dangers of it, gave some to his baby and it killed his baby. Because apparently there was enough in that, as much as he gave him. I don't know what the dose was. I can't remember that. But the
Mhm.
baby overdosed on it.
And that's a really terrible thing that probably ER providers see more than they wish to see. And so, kind of keeping in mind again that these over-the-counter medications, even when they say they're safe for kids, you might want to kind of think
Hmm.
twice about it unless your doctor recommends the medication to you and gives you kind of a clear dosing guideline on it.
And that
Um,
could even be, I would imagine, a danger for adults in the case of something like a NyQuil.
yep. Yeah. So adults, especially if you have things like sleep apnea, um, heart problems, those are the sedative in that one is actually typically the ingredient that's in Benadryl that is causing you to be a little bit tired. But again, we're worried about losing that signal to the brain that's telling you to breathe. And it just can increase that risk. And so being aware of kind of what your health conditions are and the risk of taking that medication is really important.
Wanted to mention Lauren Bostrom is in studio with us. She's a physician assistant from Tripp Family Medicine. We're at 29. Temperature seems to be going in the wrong direction at the moment, but it will warm up a little bit more today. Telephone number 208 736 0300, and we're at 851. Quick note, too. A couple of weeks ago, I was reading some comments from some friends online about someone had a cold and someone was recommending zinc. And I've heard a lot of talk about zinc over the years, but some people swear by it. Other people say it doesn't do anything. You've got a couple of notes here too about zinc, especially with children. So maybe some warnings.
Yeah, so zinc, I would say it's on the lower end of concerns of over-the-counter medications. But as far as children go, there's actually been studies showing the loss of sense of smell, which some people, depending on the situation, might find a blessing. But it's sometimes nice to let your kids decide if they want that sense of smell or not too. It's on the probably more minor things
Hmm.
on this list, but there is a little bit of a risk with zinc
Is that
that
a
you wouldn't normally think of.
temporary loss? Is that what that would be?
Permanent is what they're
Really?
finding. Yes.
Wow. But it wouldn't. Adults wouldn't get that permanent loss.
I did not see any studies on permanent loss of sense of smell in adults, and I would have to look a little bit more to see if they have done any. But this one was specific to pediatrics that
I
I
was
found.
I was going to point out I grew up thinking I didn't have much of a sense of smell, but I was driving somewhere a couple of weeks ago, and I won't say where it was in the Twin Falls area, but all of a sudden, as I was driving down the road, I smelled something that was awful, and I passed through it quickly, but it was an aroma or an odor coming from something, and so I'm still glad it's there because I didn't stop in that spot. It got out of there fast, but it was pretty noxious. One of the things we were talking about earlier off air, and I think a lot of people in this day and age, I read where in Europe if they have people have problems with stomach acid and heartburn, they have just simply learned to live with it. Americans, on the other hand, we spend billions of dollars a year on over-the-counter medicines, anything from Rolaids all the way up to Zantac, and then eventually now we have this development in the last 20 years of something called proton pump inhibitors, and people would recognize that as, I guess, the Prilosec and those. What it always some of these can be prescription too, but the over the counter.
Mhm.
There's a number of these different brands that are available, and if you don't have to take a lot of pills. If you've got heartburn, sometimes you have to go back for a second Tums later on, or even later in the
Exactly.
day. But if you take the proton pump inhibitor, you get 24 hours of just bliss. On the other hand, some serious drawbacks here.
Yeah, so proton pump inhibitors are probably our strongest defense mechanism we have access to as providers ourselves to helping people with that acid reflux and heartburn. But recently, they have found kind of long-term side effects of these medications, and ironically, they also recently became over-the-counter too, which is also a problem. Um, so people who take this chronically, and I'm talking years at a time, they have found actually leads to malabsorption. And the biggest one it leads to malabsorption of is calcium. And so a lot of people have heard of that increased risk of fractures with taking these medications long term. They did a study and they found there's about a 35% increased risk of fractures with long term use of these medications. So if you're someone who hasn't seen a doctor and are taking these medications on a regular basis, I strongly recommend making an appointment because there's a lot of complications that could happen with uncontrolled heartburn itself and with taking medications for heartburn too. And I can go a little bit into those as well. Um, so those things include if you have uncontrolled heartburn, you can actually get precancerous changes in your throat called Barrett's esophagus. Um, and so getting your heartburn under control is important. And sometimes there are indications to be on these medications long term where the risk outweighs the benefit. But usually that involves kind of seeing a doctor and getting a workup to check for that precancerous change called Barrett's esophagus too, and kind of getting direction on trying medications that might be a little bit safer long term. And those are kind of more what we call our histamine 2 blockers, including things like Zantac over the counter.
25 years ago, I remember reading a newspaper story about a fellow who had to sleep sitting up because his reflux was so bad. And there was a surgery that was pioneered at the time where they cut four small incisions and they take a muscle and they change the direction of that muscle, and that helps keep that sphincter closed. And he said it was like a miracle. He said after he had the surgery done, but I've never really heard much about surgery for this issue for people since then.
So there is a surgery out there. It's called Nissen fundoplication, which is similar to basically what you're describing.
Sure.
It is kind of a last resort type of surgery. It's a tough one to recover from, and one of the things you'll find if you have the surgery done is you're actually not able to throw up, which could be uncomfortable if your body kind of wants you to do that. And so it's really one of those last resort where you try everything, and if it's still just not able to get controlled, and your quality of life is really being affected by it, that's when the surgery really is appropriate for you.
And he said it changed his life. We've got about a minute and a
Mhm.
half to go. We'll squeeze a caller in here at the very end. Caller, you've got to make it quick. You're on the air. Go ahead.
What causes the acid reflux? Because I suffered from that for many years until I just got sick and tired and went to a doctor, and he sat down and he says, you got to let's take a look at what you're putting in your stomach. I cut out greasy, fatty foods, and by and large, that doctor, you know what? I haven't had it since, and I don't know. What do you? I think a lot of times we rely on a doctor and a little pill, and instead of taking personal responsibility and making some changes. Now, I understand there might be circumstances which, that doesn't apply, but in our overall, scheme of
Well,
things,
tell you
Yeah,
I
what.
think
Yeah.
and you are exactly right. Um, Food changes can really help because with the acid reflux, people tend to have over active acid production in their stomach, and so foods that tend to increase that secretion of acid, fatty foods, citrusy foods, that those are ones that if you avoid can often help control those. Weight loss has been shown to help acid reflux, and elevating your head about 30 degrees at night can also help control that acid reflux by letting gravity work with you and not against you.
And I've also been told too as well that it's like if you're having pizza, spicy foods on the pizza isn't the problem. It's the grease and the pepperoni. So when he mentioned grease, that was the key.
Yeah, grease is a big one.
That's why chicken is a much better topping, I think, on a pizza.
So again, Tripp Family Medicine, if you're interested in making an appointment, our phone number is 933-4400 at 1411 Fillmore Avenue.
We want to thank Lauren for dropping by today. We'll see you again in a few weeks. It's like a pitching rotation. They have the starting lineup and they rotate day to day or week to week in this particular case. We've got a short break for news coming up at 9 o'clock. And then, speaking of medical folks, Dr. Tommy Alquist, although he's now gone from medicine to politics, running for governor in Idaho, he'll be joining us just after the break, talking about his reaction to Governor Otter's State of the State address.